All right, today we're going to talk about something that's, well, a little sensitive, but really, really important. We're tackling a big health question, and we're using insights from actual medical experts to give you some clear, straight-up answers.
So, let's just cut right to the chase, shall we? The one question that a lot of people might be thinking but feel a little weird about asking, can piles actually lead to death? It's a serious question, and it absolutely deserves a serious answer. Okay, the first thing you need to know, and this comes directly from the doctors, is that death from piles alone is extremely rare. So you can take a breath. In modern medicine, the condition itself just isn't considered fatal. But, and this is a really big but, that's not the end of the story. See, here's the crucial thing to understand. The real danger isn't actually having the condition. The real danger is the chain reaction that begins when you just ignore the symptoms. Brushing off that first little sign can kick off a whole cascade of serious complications down the line.
Think of it like this. Imagine you have a small leak in your house. At first, it's just a minor annoyance, right? A little drip. But if you ignore it, that small leak can lead to rotted wood, a collapsed ceiling, a huge crisis. It's the exact same principle here. Ignoring what seems like a minor issue can allow much, much bigger problems to develop.
So, what are these serious complications we're talking about? What actually happens when you delay? Let's break down the real risks. First up is severe anemia. Now, this isn't about a single major bleed. It's way sneakier than that. It's about a slow, steady loss of small amounts of blood over a long time. That chronic loss really adds up, and it can rob your body of the healthy red blood cells you need, leading to just bone-crushing fatigue, weakness, and even serious heart problems.
Next, there's something called a thrombosed hemorrhoid. This is when a painful blood clot actually forms inside the hemorrhoid. It causes intense swelling and can be incredibly painful. This is a very clear sign from your body that you need to get medical help and fast. Now, things can get even more serious with what's called a strangulated hemorrhoid. This is when the blood supply to the hemorrhoid gets completely cut off by the surrounding muscles. When that happens, the tissue starts to die. And let me be perfectly clear here, this is a true medical emergency. And this is the most dangerous point of escalation. When that tissue dies, it basically becomes a breeding ground for bacteria. This can lead to a severe body-wide infection called sepsis, or even gangrene. Both of these conditions are absolutely life-threatening and require immediate emergency care.
Now, this slide highlights probably the single most important reason not to just diagnose yourself: rectal bleeding. It's a common symptom of piles. But you know what else it is? It's a key symptom of colorectal cancer. Assuming your bleeding is just piles could cause a catastrophic delay in diagnosing something far more serious. It's a risk you just can't take.
Okay, so keeping all those risks in mind, what are the clear, non-negotiable signs that mean you need to see a doctor immediately? Let's get into the stuff you can actually use. The experts are very, very clear on this. You do not wait if you experience any of these things: heavy bleeding that just won't stop, sudden severe pain, a lump that's maybe turned blue or black, or any signs of infection, like a fever or chills. Think of these as your body's emergency alarms. You have to listen to them and get a medical professional involved right away.
Now, I know after hearing about all those complications, it's really easy to feel anxious. But here's the most empowering part of this whole topic. The danger isn't a given. Let's look at the power of getting treatment.
And this right here is the core message I want you to take away. Every single one of these severe complications we just discussed is almost always preventable with an early diagnosis and the right medical care. The key point is that you have the power to stop that dangerous chain reaction before it ever really gets started.
And it's really important to know where this guidance is coming from, so you know you can trust it.
The information we shared today is based on decades of real-world hands-on clinical practice from the pioneering surgical team at Arka Anugraha Hospital. We're talking more than 30 years of experience. In fact, it's been shaped by the deep expertise of specialists like Dr. Ramesh Makam, a surgeon who has, get this, over 45 years of direct experience in this field. This is wisdom that's been earned from a lifetime of treating these very conditions. So, we'll end with this final thought. We've seen that the medical risks are manageable with timely action. This really suggests that the greatest risk of all might not be medical but personal. It's the silence and the delay that are caused by embarrassment. And that really brings the choice back to you. The path to safety is clear, but it requires taking that first step.